Welcome to Woman2Woman today, where we're having intimate conversations with inspiring women while doing fun projects that will teach us something new. I'm your host, Jen Maseda, and we want this show to be a bright spot in your lives. If you or someone you know has been impacted by breast cancer or a breast cancer diagnosis, you know how confusing and frightening the next steps of treatment can be. In honor of the strength of women breast cancer survivors and those that have lost the battle, today's show might save a life, and it will definitely eliminate your fear and disprove the prevalent myths about breast cancer. With us today is Moser, the breast health nurse from Metro West Medical Center, and she's available for patients of Metro West Medical Center. So welcome, Lori, and thank you for joining Woman2Woman today. We appreciate you being here.
Thank you. It's nice to be here.
Thank you. So how long have you been in the breast business or caring for women with breast cancer?
So I've been doing breast health for about 7 years, and I did oncology before that. So I've been at Metro West for about 2 years now.
Okay, and you have a lot of different letters behind your name. Can you share just your expertise and some of those titles? Because you're an oncology nurse. You also have a lot of different degrees and certifications. So tell us, please.
So I'm a registered nurse, and I do have a Master of Science in Nursing, and then I am a certified breast care nurse and a oncology certified nurse, and those are both national certifications for those specialties.
Yes, so that makes you an expert in breast health. What does it mean for someone to have found you? Why do they reach out to you? Who is it that you care for?
So my actual title, I'm called a breast health navigator. And so the navigator part basically is just helping people get through the healthcare continuum. A lot of times somebody will come in and they've made a recommendation and they're just not sure what comes next. How do I follow up on that? Maybe they've been given a diagnosis and they don't quite understand it, so I can help explain that. I can help find them resources. I can be an ear to talk to. I can talk to family members if they need help explaining that, how you talk to your children. So there's really a lot of things that I can assist with for patients.
Yeah, and once you get that diagnosis from a physician, you know, it's potentially not at Metro West Medical Center, but in some cases, when you enter the doctor's office, it is intimidating, and you don't get a lot of opportunity to ask the questions, especially right when they hit you with the diagnosis. It's such a shock. You need to process this information. You go home, and then they make a referral to you. Is that right?
There can be a lot of ways that patients find me, and that actually is one thing that I say to patients all the time. They may see me in my office, and then I'll say, here's my phone number, because when you get home, you may not remember everything we said.
That's right.
Call me, and we'll go over it again. New information takes a long time to absorb, and especially a breast cancer diagnosis, that's information you never wanted to get. That's not fun learning. That's learning that you have to do.
Right.
So that's pretty much, they can find me on their own when they come in for imaging. Their physicians can say, hey, there's a breast specialist over there, a breast health nurse over there that can help you out. The radiologists who read the breast mammograms or ultrasounds, MRIs, may tell the patient, why don't you give Lori a call? And also our techs will do that as well.
That's fantastic. It's the communication between all those different offices and all the information that you're receiving comes through you, and it's such a blessing that you're there for individuals. And what I also think is really tremendous and comprehensive is that, as you said, it's not just the patient, it's also the patient's family, it's their caregiver, it's also the community. So tell us some of the things that you are doing in the community in order to not necessarily prevent breast cancer, but find the diagnosis, find the issue early on, and we'll talk about timing on that too.
So I do attend health fairs that go on all over our community, and I could talk about self-breast exam. We talk about, we kind of promote the importance of having a screening mammogram done every year. Metro West has a really great screening program, and we have 3 different sites where you can go in and get your mammogram. We have a walk-in program, so if people, what's great about the walk-in program is that if people are nervous about a mammogram, they may not even want to schedule it.
Right.
But they may have a cup of coffee one morning and be driving by and say, I can do this.
I'm going to do it today.
And in they walk, and here we go.
That's fantastic.
So, yeah.
Yes. So you're telling me a little bit about the setup. You said there were 3 locations that you can do it. Tell me about a location that you can do the walk-in and what happens when you get there and how you treat the women, because you were saying it's almost like a spa where you're wearing a robe. It's really a different mentality than the hospital gown and the bright lights and the sterile, everything's sterile obviously, but it's a different feel that you're trying to emulate or trying to create.
Exactly. We really want to encourage women to come in and get this screening mammogram every year. Most women, that's all they need, once a year. There are some women who need a little bit further testing. They may need more pictures taken.
Well, tell us why that is.
So if you have a screening mammogram and they see something on your mammogram that maybe has changed from previous years, then they'd want to look at it a little bit more closely.
Okay.
It doesn't mean that that's cancer.
Okay.
In fact, most of the time, over 80% of the time, it's not cancer.
Yes,
so
I've
they
heard
call you
that
back.
a lot.
Exactly.
Yes, right.
But you're going to get a phone call the next day, and we're going to say you need to come back in for more pictures, and sort of that's almost the start of it, where women start to feel that anxiety, because nobody wants a phone call after their mammogram. You want to just put it aside for another year.
Yeah.
So coming back for more pictures, they can do more mammogram pictures where they can magnify it.
Okay.
They can take it from different angles.
Right. Because now they know they've identified something and they know what they're looking for more specifically.
It's targeted to one area. They can compress the tissue a little bit differently.
Okay.
You might need an ultrasound. So again, most of those women, once they come back from our pictures, they're done.
Okay.
As far as our sites go, we have a site at Leonard Morse Hospital.
Okay.
We have
in Natick?
In Natick, yes. We have a site at Framingham Union in Framingham.
Okay.
And then we have a Women's Health Center in the Wellness Center on Route 9 in Framingham.
Great location. It's right down the road here from the studio. That's
exactly,
perfect.
exactly. And all 3 sites do the walk-in mammography. And what would happen if you did walk in is they would register you and take your name, your insurance information, that kind of stuff. And they will let you know, we're going to take you right in. It may be an hour wait.
Okay.
So they'll let you know an estimate of how long it will be. It just depends on the workflow of the day.
Sure.
And some women are happy to wait. Some will come back and have lunch and then come back in again.
Okay.
And then we'll get the screening done.
Okay, tell us about the screening, because how old are you when you first should be starting doing a breast screening?
Okay, so there's been a lot of stuff on the news lately about the United States Preventative Task Force kind of changing the recommendations to put it a little bit older, closer to 50.
Oh, thank God.
Yep, well, but wait, there's more.
I'm getting there.
So we, the American College of Radiology, we kind of go by their recommendations, which is still to start it at 40. Okay.
Wow, that's a huge difference between 40 and 50.
Yeah, it's always been 40.
And what if you have some history within your family?
So that is definitely something that should, that's kind of a risk factor.
Okay.
So if you're unsure of which way to go, should I go at 40, should I go at 50?
Right.
If you have a family history, definitely you want to go sooner rather than later, because it's a risk factor.
Right.
Having a family history increases your risk of getting breast cancer.
And what are some other risk factors that you can identify for us?
So age is the biggest risk factor for breast cancer. So most diagnoses for breast cancer go somewhere between probably 55 and 70. That's the biggest number of diagnoses that are made.
Okay.
But they can range all the way. They, women in their 30s, all the way up to women in their 90s, and we have seen women as old as 90.
Okay.
For diagnosis.
More prevalent at 55, more prevalent at 70, or it's just a range in between there?
So in that age range,
Yes.
that's where most people get breast cancer.
Okay.
People who get breast cancer.
Okay.
So a 40-year-old woman, her chances of getting breast cancer are about 1.5%.
Okay.
Pretty low.
Right.
Pretty low. And that's a statistic across the United States.
Okay.
And so that kind of plays into why the Preventative Task Force has started suggesting later mammograms. But my point of view, and I think that we all have to look at it, 1.5% is a pretty small number.
It could be you.
Yeah, exactly.
You could be that 1.5%.
It's a small percentage,
but
it's a big number.
That's right. And if it's you,
Yeah.
It's an even bigger issue.
Exactly.
Right?
So if you look at women between the ages of 40 and 50 in the United States, there's millions of them.
Sure.
So 1.5% of however many million women there are in the United States,
Sort
you're
of a
looking
lot.
at hundreds of thousands of women.
Yeah.
So that's kind of another reason why
Sure.
the American College of Radiology does say, no, let's keep it at 40.
Sure. So family history, age, what's another risk factor?
So obviously gender. Of
Okay.
course, women are much more likely. Only about 1% of men of breast cancer diagnosis, only about 1% are men, but it doesn't mean they can't
Still
get
happens.
it.
Okay.
Genetics, which is a little bit different than family history, but it kind of plays in together. You might have a strong family history. They may test you for the gene mutation and you don't have it.
Okay.
It doesn't mean your family history is not relevant.
Okay.
So it is a little bit of a separate thing. Race plays into it a little bit. Caucasian women are more likely to be diagnosed with breast cancer. They get it a little bit more frequently than, say, African American.
Okay. What are there a particular reason for the genetics based on race that are different? How is that?
So those are definitely areas of study.
Okay.
So I don't know that they can actually say why that is.
Sure.
It could be genetic. It could be cultural.
Right.
Women who tend to not get their mammograms until they find a problem, that kind of thing.
Okay.
Yeah.
Latinos, do you know?
So
statistics for
Latinos
that?
are a little bit less than African Americans.
Okay.
So Caucasian in the United States is the highest percentage. And they do, if you say 12% of women over their span of their lifetime will be diagnosed with breast cancer, about 13% are white.
Okay.
Or 13% of white women will be
Right.
diagnosed. I think it's about 11% for African American and like 10%. And I'm just kind of averaging those out a little bit.
Yeah.
So, yeah, it's
Okay.
not a huge difference, but it's a significant
Sure.
difference.
Any other risk factors?
So there are. If you started your period early before the age of 12,
Okay.
or menopause late after the age of 55,
Really?
that's
Why
a risk
is-
factor.
Any idea why that?
So they think that it could be just
associated?
exposure to estrogen.
Okay. Okay.
If you carry your first pregnancy after the age of 30.
Okay.
So younger
great.
pregnancies is better for breast cancer.
Okay.
But it
Whoa.
doesn't. Yeah, it doesn't mean go out and get pregnant
of us
before
are
you
not
turn
ready.
30. Yeah, exactly. So when we talk about modifiable risk factors,
Sure.
that technically is a modifiable
Okay.
one, but it's not really. That's part of your lifestyle.
Okay.
Let's see, breastfeeding. If you breastfeed for longer than 6 months, that can have some risk reduction to it.
Okay.
Let's see, what else is there? Smoking, of
Yeah.
course, and obesity, especially women who are postmenopausal.
Okay.
Yeah, not only obesity, but overweight, which there is a little bit of a difference. So
Okay.
it is important at any age to maintain your weight, but especially over past menopause,
Past menopause.
it does increase your risk factors of breast cancer.
Okay. And you said that there is a great health fair that's coming up specific to women's health, and breast health information will be there. Tell us about that.
So we're having it's sort of like a breast health information session at the Verve, which is at the Crowne Plaza in Framingham. We're doing that on October 20th. And what we're going to be doing is we're going to have a panel of breast experts. They will include a radiologist, an oncologist who would be a doctor who would manage cancer. We'll have our breast specialist who's a surgeon who will sit on the panel as well. And we will have a patient who has gone through our system and can kind of
perfect.
give us that perspective.
Absolutely.
And we're
That's
just
a great
going to
idea.
take questions, talk about breast cancer, talk about prevention, talk about screening,
Yeah.
and then
making
we'll
it,
have
making it an easier process for people to be able to
Learn about it.
right?
Yeah, yeah.
Okay, so we're going to take a break now, and when we come back, Lori is going to show us how to understand our breasts, become familiar with them, so we can identify any changes in their texture and in their makeup. So keep watching.
Hi, may I please have an application? Thank you.
Skip the drama. Get your diploma.
Okay.
Take that first step towards a better future. Find free adult education classes at finishyourdiploma.org.
Look at you. You're at the top of your game. At work or at play, you're unstoppable. Nothing can throw you off track. Oh, hey. She's cute. Nice going, man. Things are going great for you. You've earned a night out. Good drinks, good friends. Yeah, we can go ahead and call this a good night. Wait, is that your car? Uh-oh. Not smart. Yeah, I saw that coming. Say goodbye to her. Ouch, that'll hurt your bank account. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. I hope you like eating frozen dinners. Alone. Let's try this again. Smart move. Because buzz driving is drunk driving.
Todd's a great guy. I mean, look at him. What a sweetheart. Attaboy. Wait, Todd, what are you doing? How totally selfish and un-Todd-like of you. Come on, Todd. Come on, man.
Welcome back to Woman2Woman today, where we inspire women to reach their goals and learn something new and fun at each show. I'm your host, Jen Maseda, and we're here with Lori Moser, the breast health nurse navigator at Metro West Medical Center, who provides education and resources to breast cancer patients, their families, and the community at large. So welcome back, everybody. Lori, we've got a short amount of time. I want to get to a couple of things. First off, you brought a gel breast. Tell us what you do with patients and with community members on showing them how to test.
So the purpose of this is really just to show people that when you're doing a breast self-exam, you can't kind of just do one of these and think you've checked your breasts.
Okay.
Inside this insert, there's actually a bunch of little tiny BBs, and they're all located at different depths of the breast. So this one, and I know it's hard to tell on TV, but I can feel that just by barely touching. I can feel it. It's right close to the skin.
And you're supposed to touch with the pad of your fingers, right?
Yeah.
You're not really poking at your breast. Your
It's not
hand.
a poke like this.
Okay.
It's a pad of your finger.
Okay.
And you shouldn't be lifting up your fingers. You should just be moving it along. So
Because
this
you
one,
might miss a spot.
exactly,
Okay.
and cause friction.
Okay.
So this one you can feel with just a very light touch. One of the deeper ones, you can probably tell, in order to feel it, there, I can feel it. I'm putting a lot of pressure there.
Yeah, I
So
noticed.
it's
In order
pretty
to get
deep.
to that one,
It's
you
pretty
really
deep.
And can you hurt your breast in any way by doing that?
No, you're
Okay.
not going to hurt yourself by doing that.
Okay.
And you use a basic common sense rule of thumb. Of course, if it hurts, then stop doing it,
Okay.
type of a thing.
Okay.
But when you're doing a self-breast exam, the important things are that you do it every month so that you
Okay.
really get to know your breast, so that you know when you have a change.
Right.
Doing it in the shower is helpful because there's less friction.
Okay.
And the most important thing is that you're looking under your arm. You're looking at your entire breast. The old school way was to do a circle, kind of going around like just around like that.
Sure.
Now they tend to go up and down. But
Okay.
again, the most important thing is that you're doing it.
Right.
That you're using different levels of pressure.
Okay.
And also know that if you don't find something and it is picked up on mammogram, it's not your fault.
No.
Sometimes things are really deep in the breast, and
Right.
you're not going to feel them
Right.
no matter what you do.
That's why it's critical to go for your mammogram.
Exactly,
Yes.
exactly.
Okay.
And then part of a self-exam is to look at your breasts in a mirror so that
Okay.
you're seeing symmetry, any dimpling
Okay.
of the skin,
Right.
changes like that.
On the outside.
On the outside.
Okay, so tell us about this chart, because this is essentially what happens when you come in for
Yes.
a mammogram. Okay.
Yes. So breast density is something that since the beginning of breast imaging, radiologists are aware of how dense someone's breast is. This
Okay.
is not something new. You had asked me about risk factors, and I don't think I mentioned breast density, but it is a
Okay.
risk factor. So radiologists will grade your breast density from almost entirely fatty, and you can see it's just nice and clear. It's dark on a mammogram, very easy to look at.
Okay.
To extremely dense, which is mostly white.
Okay.
Unfortunately, when you have cancer on a mammogram, it's also white.
Okay.
So you can imagine that it would be
Tougher
very
to
hard
find
to
in this
find
one.
on this
Okay.
breast than this breast.
All
So
right.
that's one of the reasons it's a risk factor.
Okay.
But another reason, which is more the true reason,
Right.
is that something about dense breasts is more conducive to the growth of breast cancer.
Okay.
So a radiologist who is trained, and at Metro West we do have fellowship trained breast radiologists.
Okay.
They're going to be able to read your mammogram no matter how dense it is.
They know what they're looking for.
They
Right.
know what they're looking
Okay.
for, but it's still
Tougher.
harder to see.
Okay.
Dense breasts are not abnormal. 50% of women have either dense or extremely dense breasts. So
Okay.
it doesn't mean there's anything wrong with you. It just means your risk factors are increased.
Okay.
So what your doctor will do, we are sending out letters. It's part of a new Massachusetts law since 2015 that women need to
okay.
be notified of their breast density
Okay.
if they're dense. So if
Okay.
you fall into one of these two categories of dense or extremely dense, it's going to say that on your mammogram letter. And it's going to say you may be a candidate for additional imaging. It doesn't mean you're necessarily going to need additional imaging. So
Right.
they're going to put other factors together. Do you also have a family history?
Right.
Do you carry the breast cancer gene mutation? Things like that.
Okay. So you brought a lot of resources too, but I definitely want to touch on this because if you're coming in, you get your mammogram and you're identified as just needing another look or some other treatments, it's costly. Getting in a car, getting in a cab, getting to the location, that's why you are such a gift to the Metro West community. And it's such a blessing that Metro West Medical Center has established you as a staff member and a critical staff member in their cancer center. Because essentially you're making it so that everyone has access to this treatment. So tell us a little bit about how you're closing the gap essentially on access and ability for access.
Mm-hmm. So a lot of my job is education, and I think that educating women about mammograms, about screening, it empowers them. So just letting them know that, a lot of times I've had women say, well, we do 3D mammography at Metro West, and some insurances are not covering that. So we have women who will not do it because it's not covered by their insurance. Well, come talk to me. Because we do have, Metro West has a program where we can offset that cost. We can actually eliminate that cost so that you can get a 3D mammogram. If you have transportation issues, there are resources in the community that we can tap into to get you to your appointments.
That's great.
Especially with the Cancer Center. We do have a certified oncology social worker, and she has more resources than anybody would even know existed. So if something isn't going your way, if you don't understand something or you don't think it's possible, pick up that phone and make a phone call. I certainly can't promise that we're going to get every single thing, but sometimes you just don't even realize that there is help out there available.
Something that exists.
And we want to try to even that playing field so that everybody has access to care. And that's a big part of navigation, is just helping with that. Identifying what's the barrier and how do we break that barrier so you get what you need.
Right. And we all know stories of people that have had family members that are in the hospital or friends that are in the hospital, or they themselves have been in the hospital and they're not getting things answered, or they don't know that there are some additional testing that they could do. If you don't have a family member, and I do, so I'm really lucky, so I'll call him, and he probably hates it, but I'll call him and say, hey, I got a question about this, either for my husband and I, or the rest of our family or our kids. But if you don't have somebody that is knowledgeable about the medical system, it's really critical that they have someone like you to be able to, again, that navigator term is such a beautiful term because you're helping people to navigate at a time that is so stressful and so emotionally fraught with, with feelings that almost don't allow you to think logically and positively, and so it's really a blessing that you're there.
Thank you.
Absolutely. So thank you for being here today.
It was a pleasure.
We are so grateful that you came and you shared this gem of a resource within our Metro West community. Please remember, everyone, October 20th, go to the Verve, which is in Natick. It used to be the Natick Crown Plaza. Make sure that you're there so that you get all the information that you need. So a big thanks to you, Lori. Really appreciate you being here. Please remember to follow, like, and subscribe to Woman2Woman Today on Twitter, Instagram, and Facebook, and YouTube so you don't miss a show. Thanks to the entire team at Access Framingham, especially Shavarsh Morrissey and Francesca Cerruti Harris. Thanks also to our amazing Jess Friswell, our assistant producer. I'm Jen Maseda, your host of Woman2Woman Today. Thanks for watching, everyone. See you next time, where we hope to inspire you.